they say kila mtu akona wazimu zake, the degree is what matters.
Yeah.
This is not true. The truth is that everyone may suffer a mental illness at some point in time. You can't really tell me that someone who is suffering depression is insane. You can't tell me that someone with anxiety disorder is insane. But that insanity has brought about stigma and wrong perception about this. So
Why would it be more in women than men?
the ratio is the margin is not that big, but you realize that women have got some challenges in life because of their nature.
Yes. Today we are covering a very interesting topic on mental illnesses. I'm saying illnesses because I understand there are so many, and especially things that we don't know and they stay with us around. And so now that we are so privileged to have Dr. Kirimi, he'll be able to explain to us what mental illness means, and definitely we will deliberate on different issues on mental illnesses. And I hope that this is going to be of help to you, especially to you as a person, and even to the people that you stay with and to the people that you interact with daily. So karibuni sana. Thank you for every person that has subscribed to our channel. Thank you for all the views. Thank you for all the likes. We really appreciate, and we hope that this video will also help you to become a better person in your daily life. So yes, karibu sana daktari.
Thank you. Thank you so much. I feel grateful for this privilege to have an opportunity to share on matters mental health.
Yes.
Because this is actually a field in medicine that has been neglected by many people, even the community and the society. It is a privilege today to discuss on this issue of mental health.
Yes.
Yes.
So maybe before we go to you telling us what mental illness is, tunaweza answer with who is Dr. Kirimi?
Okay, thank you. Okay, my name is Isaiah Kirimi Laibo. I'm a clinician by profession. Yeah, I work in this facility, Hope Medical Center, with Dr. Kiome, who is a psychiatrist. We have been managing mental health with Dr. Kiome since March the year 2018. We also manage other conditions, medical cases, medical conditions, but this facility is well known for mental health and psychiatric disorders. All of them, we manage them here.
What is this mental illness? In the simplest term,
mental illnesses are all illnesses that may be affecting the brain and affecting your behavior, your mood, the way you work, the way you carry on with your activities. And I want to put it clear that brain is an organ of the body, just the same way the stomach is, just the same way your kidney is, just the same way your liver is. You know, every organ of the body has its functions. But when you come to the brain is a complex organ. When you are sick and you got problem with your stomach, the possible signs and symptoms you may have are vomiting, diarrhea, nausea, and abdominal pain or cramps. When you have problem with your bladder, there may be problem with the urination, maybe frequent urination, maybe burning sensation when you're urinating, maybe dark colored or blood stained urine. When you have problem with your chest, you may have cough.
Yes.
When you have problems with your lower limbs, that is the legs, you may have challenges with walking.
Yes.
How about the brain as an organ? The brain is a complex organ which affects the whole body, which
Yes.
communicates with every part of the body, which is like an engine. We are actually our brain.
Yes.
The brain is us. It is the one that lives in this body. It has connection to every other part of the body. That is why now people may not understand that there are problems like psychosomatic illnesses. A problem of the mind presenting physically.
Yes.
You will hear someone who has had issues with hyperacidity or acid, ama anasema anakuwa na shida ya acid, inatibiwa haiponi. Inapewa the best drugs antacids haiponi.
Yes.
H. pylori kama iko inatibiwa inaisha haiponi. When they come for review for checkup, you may realize that this is a problem of the mind, and when you treat it accordingly, you solve it.
Yeah.
But no one will expect that this can be a problem of the mind.
Yes.
Remember, I always give people this an example because we have really seen cases where people have had their lower limbs or upper limbs amputated, but you feel or you hear them saying that they feel pain or itchiness at that particular part that was amputated.
Yes.
Because there is still that connection. There's the nerve that was supplying that particular part is still there.
Connected.
And even if it's not there, there could be the perception that that thing is still there.
Yes.
And I feel like I need to scratch
Yeah.
myself. The brain is a complex organ. The brain can cause vomiting where there is no problem with the stomach.
The stomach.
You wonder why? Remember when people induce vomiting by a way of putting their hand in their mouth.
Yes.
There is no amoeba that is in your stomach.
Yes.
There is nothing wrong with your stomach, but the brain is communicating with the stomach, so that now the brain tells the stomach that whatever is in the throat there is not food, and it's not something good. You need to take it out of that place. The stomach asks the brain, how can I do this and I don't have hands? The brain tells the stomach that whatever content you have, push it out. As it goes out, it will knock that thing out. And that's actually what happens.
Yes.
When you're inducing vomiting by way of putting your hand in your mouth, definitely once you start vomiting, there is no one who will come and tell you, put that hand out of the mouth. You
automatically
pull it out.
Yes.
So this is an indication that there could be, when there is a problem of that high center of vomiting affecting that center in the brain. We call it centers, reflexes centers. They may cause vomiting where there is no problem in the stomach, among other connections of the body. Another thing, someone may present with what we call tactile hallucinations, whereby they feel bodily movements.
Yes.
There is actually nothing that is moving in their body, but they feel like maybe panya inatembea juu ya mguu yangu, inakuja inaniuma sikio.
Yes.
Among other sensations that will present it physically, or they feel it is physical, but it is psychological.
Yeah.
We actually classify mental illnesses in many ways. We can first of all classify them into somatic disorders, whereby somatic disorders will present with changes or effects to our physiological body. We also classify them into affect disorders, which affect the way you think and the way you feel. Others are conduct disorders, that which affect your behavior and even your emotions to other people. So mental illnesses are broad, there are many. It is a broad area of medicine whereby we have many illnesses, many disorders, some of which are presenting like other medical conditions, and some which are different from what people perceive them to be. Yes.
What are these some of the things that will make you know that you are sick mentally?
Okay, you have said it well, because it's true. Some of mental illnesses will just look like a common or a normal behavior, but what makes it an illness is that this is in an exaggerated manner. So that now maybe you seem to be a very outgoing person with a good mood and attitude towards people, but it will reach a time whereby in some illnesses, like in bipolar mood disorder, in the hypomanic episode or manic episode, this person will look hyperactive, with the urge or what we call pressure of speech, and generally when a layman or that person who doesn't understand this illness or disorder, this may look normal but in an exaggerated manner, and that's why they may not realize that this is an illness. So what I tell people is that whenever you find a case that you are suspecting or you suspect yourself, because actually as we discuss when we are going to share things on matters, signs and symptoms of mental illnesses, someone somewhere may try to diagnose themselves, but it is not good, because in our guidelines we got a criteria to which we use, and we use this criteria to diagnose, so that we can be able to tell where there is an illness and where there is not. Yes. So in a case where you're giving an example that someone says uko na shida ya akili, they may or may not be having problems, and even the perception of the one who is saying this may not be correct. Yes.
What is the situation right now kwa ukiangalia even around the country, and also maybe who are the most affected with this disease?
Okay. The society, the community we are living in, it has a different perception into mental illnesses to some extent, and the community has neglected the mental illnesses, because if so and so get sick and they are termed to be diagnosed with a mental illness, the society kind of accepts them that way, and maybe thinks this is a natural process that is occurring, happening. Maybe they have to stay in that situation and for the rest of their life. Maybe this is witchcraft, you know. Maybe this cannot be treated. Maybe this is pretense. Maybe this is a curse. This is a condition that cannot be managed. It could be possession. And these are the myths and misconceptions surrounding mental illnesses, and challenging the treatment, because sometimes even when these people come for medical attention, they are not ready. They lack what we call insight, the inner knowledge, the acceptance that I can really be diagnosed with a mental illness lacks. So the myths and misconception will affect treatment, and definitely the prognosis or the after life of this becomes a challenge to whoever is suffering. So myths and misconception have challenged
Yes.
people, have led to people go untreated. And of course, when these people stay for a long time without treatment, there are associated or there are complications. They will pass or go through many challenges
Yes.
without treatment. So the society needs to wake up. The community needs to be sensitized. We all need to know that the mental illnesses are manageable, they are treatable, they are correctable, as long as someone will come for treatment and continue with follow-up and review in whatever facility they are getting treated and accept to take medication. Remember when I was talking about that perception by the people, they call every mental illness an insanity, whereby that is not true. Because you can't really tell me that someone who is suffering depression is insane. You can't tell me that someone with anxiety disorder is insane. But that insanity has brought about stigma and wrong perception about this, and people fear to come for treatment, or even after they come for treatment, they will fear to take medication. They will fear to get injections because they think that Daktari will inject me with a drug that is meant to treat insanity. What people the condition that is so common that people know about or in mental illnesses is a condition known as schizophrenia. Schizophrenia, which is characterized by total social withdrawal. These people may even withdraw from the family and go away to live in a ditch somewhere, or in the bush, or in the market. They sleep anywhere. They collect garbages. You know, they have what we call self-neglect. They can't bathe. They can't brush their teeth. We actually say that this is a condition of the mind that can get a very prominent person from their office to the market to collect garbages. It is also manageable when it is diagnosed with time. Many cases have been reported to recover. But the problem now, when the perception of the relatives, because you can't really rely on this person who is sick to seek medical attention. There must be some relatives behind this who are pushing this and actually facilitating this. And that's now what brings us to another challenge of affordability. Mental illnesses will not be treated for 5 days. Remember, this is not a bacterial infection. This is not a fungal infection. This is not viral infection. You have to be on medication for quite some months, from 3 months to 6 months to 9 months to 12 months, depending with the illness, depending with your compliance, depending with your commitment to this. Because some, at some point in some illnesses, they will feel better and now think this is not the right time for me to go back to pay consultation fee, to buy some other drugs. I'm feeling okay. So they default. So when they default, depending with the illness, it may take them different durations with this, and this varies with individuals. It may take you 2 weeks, it may take you 2 months, they may take you 1 year, and the problem comes back, and they may come back in a complicated form. And when now people see this, they believe that this is not to be managed. So we encourage people, whenever you feel sick, or whenever you fall sick, whenever you are on medication, it is good to complete the dosage. It is good to honor appointments. It is good to go back for review.
Yeah.
Whatever the illness, by the way, even a medical condition, when you are given a day to go back for review, it is good, because even if you are feeling better, at this point now, the healthcare provider is in a position to know better about this illness, whether it has gone, whether it is fully managed,
Yes.
and what really may happen thereafter. Yes.
Who are the most affected na hii ugonjwa?
Okay.
Ama who can get this disease?
Okay.
Is it anybody? Is it who is eligible? As in, who can be sick any day, any time?
Okay, that's a good question, and that reminds me of a question I saw somewhere. I don't remember. I believe it was in social media, and actually, it's not only in social media. This is a problem or a question that is never solved or answered by anyone, because people say that they say kila mtu akona wazimu zake, the degree is what matters.
Yeah.
This is not true. That everyone is mad, the degree is what matters. That is not true.
Yes.
The truth is that everyone may suffer a mental illness at some point in time. When they are living to their a long life, at some point you may feel depressed.
Yes.
You may have stress. You may suffer anxiety, and sometimes this may mimic the illness. Actually, when we say you are in a depressed state, this may not mean depression, and this may not mean depressive illness.
Yes.
Because at some point you feel you are in stress, you are thinking, you are trying to figure out things, they are not adding up, you have high expectations you have not achieved, maybe you feel you are overtaken by time. At some point we are down, but this does not mean depression. Depression or any other mental illness should be diagnosed in a health facility. So it is high, or the percentage is big in young adults, unless in the aged above 50 years of age. Comparing male and female, it has shown to be high in female to a ratio of 2:1, whereby we have now a challenge in male, or in men, or in boys, of course, who are in high school, in campus, in college, the teenagers, and the challenge, or what is causing this increase in number of this generation falling into mental illnesses is the fact that they are indulging in drugs of abuse. And this is a challenge, a problem, an enigma that has resulted to an increase in number of boys getting mental illnesses. Yes.
I'm shocked that women carry the burdens. Wacha nijitete.
Okay. That's true.
Why would it be more in women than men?
The ratio is the margin is not that big, but you realize that women have got some challenges in life because of their nature.
Yes, the way we are created.
These are people who may suffer torture in the hands of men who are not doing the right thing to them.
Yeah, true.
You realize that a woman's body is not like a man.
Yeah, true.
And that's why we have someone, a female at Menake, wondering what is really happening in my body, that I've started to experience some periods, menstrual period, the flow. Now at that point, some of them may have challenges, and if not cancelled well or advised or thought about this, they may break down. You also know that women after marriage, and some of them who conceive before marriage or who conceive while in school,
Yes.
they carry another burden of lactating and dropping out of school for lactation, while that boy who was involved in that same intercourse is still continuing their
life is normal, like they were never involved.
Yeah.
Yes.
So women have got some challenges, especially now that which come early in life, in teenage, and this is what may affect the rest of your life, because if you drop out of school, this will affect your life. Maybe it will kill your dream.
Yes, true.
I think before we talk about signs and symptoms, we can also talk about drug abuse, because this is actually a problem that has caught many people into falling into mental illnesses, where also mental illnesses have also resorted to drug abuse.
Or it can be both.
Yeah. Starting with the drug abuse that may resort to addiction, dependency, or psychological problems. You can say people start this as as a habit, sometimes as from the peer influence, sometimes from curiosity. They just wanna experience the euphoria or the feeling of drunkardness, or the effect of that particular drug. Now, after a while, and this thing varies with the individuals.
Yes.
Remember, people outside there, they will say that even when you try to warn them against the danger signs of drug abuse like alcohol, bangi, marijuana, they will say so and so has been abusing this thing for quite some time. They are okay.
And they are okay. They are
So
doing
why
well.
should I stop?
Yes.
So and so has been taking or drinking the local illicit brew prepared in the villages there. They are now 70 years or so. They are okay. So why should you tell me that alcohol is not good? Others will tell you that so and so smokes bangi thrice a day for a long time. They are okay. Why should you want me to be? The other day I saw a certain, I don't want to mention their name, but this was a professional, someone who is learned and is really out there with some young boys trying to show people how marijuana is good and it's okay, it's a good drug, it is harmless. They are trying to legalize it.
To legalize, yes.
I want to say that our bodies are different. Actually, if you took two boys of the same age, weight, and even height, you exposed them, let's say alcohol, then they take the same amount.
Yes.
For a certain duration. One will seem to be drunk, the other one may not be the same.
Yeah.
Or the extent or whatever they do may differ. Someone will misbehave, another one will not.
Their behavior will differ.
It will differ.
Yes.
If they continue that way for a month, for a year, and they continue, you are still observing someone will get a liver problem, the other one will get a mental problem, the other one may get a stomach problem like carcinoma of the stomach, the other one may get a throat problem. we may not get the same illness at the same time.
Yes.
So when you're talking about someone who has been taking alcohol or any other drug for a long time and is okay, you may not know what they are undergoing.
Yeah.
These people may have a broken marriage because of some other medical problems or psychological problems that can cause the same.
Yes.
This person might be having or going through or lacking sleep the whole night. Insomnia is there. This person may be suffering certain delusions. This person may be having different problems that you, as the one who is using that person as a reference, may not know.
Yeah.
People have abused drugs because of lack of knowledge, because of the disbelief that this can cause an illness. They have succumbed into illnesses while seeing, and it is not good.
Yeah.
I think people need to understand that some also psychological problems you are trying to mask with abuse of drugs like alcohol. Like some other people will take alcohol so that they can get a good sleep at night.
Yes. Tunakunywa stress.
Yeah.
Yes.
But you realize that stress which is causing you to do that, when you wake up in the morning, you find it still there.
Yeah.
Of course, there is no known direct cause of mental illnesses.
Yes.
But according to the researches that have been done, it has shown that drug abuse like marijuana, alcohol, and all other drugs of abuse which are not medicinal,
Yes.
they, together with other factors like a trait of a mental illness in the family, even the environment, or if there is a history of traumatic exposure, either of these factors or all of them combined, or 2 to 3 of the factors combined, may put someone at a higher risk of developing a mental illness.
You know, as you talk, it's when I'm realizing, especially the young people, they hide in drugs. So you realize you don't have a job, and then the following day you are drunk. Inakuletea shinda zingine, because the minute you become an addict, you have to sustain the drinking, right? From what I'm getting, drug abuse is one of actually the main, it's where the biggest trouble is in the generation that we are living in. Is that right?
That's true, because drug abuse has resulted to mental illnesses.
Yeah.
And those with the mental illnesses have hid in drug abuse. So that now, even when this mental illness is complicated by the drug abuse, everyone will say the drug abuse was the result and there is no way out here. And that's why some of them also will not turn up for
treatment,
for medical attention. And people also will say, let them continue that way. It's upon them. It is their decision. They will be neglected or let to continue taking alcohol or any other drug. Watu watasema ni shauri yao, wao ndo wamejiamulia. They will not be aware that this person might have been suffering from depression. Someone is lacking sleep. They have insomnia. They are not able to sleep at night. Others feel they are down. Others feel they are not strong enough even to carry on with their daily activities or to come to involve themselves with others, to socialize with others. Now they think, maybe when I smoke bangi or when I drink alcohol, I'll be better. That's when that will be my better version. You know, and that's when now they form this habit, which comes and becomes a disease thereafter. It becomes hard to stop. It complicates to another problem. Whatever they were masking now becomes complicated. And when even the parents or the relatives or friends know this is what is happening and this has been their behavior, they will attribute that problem with their decision to indulge in drug abuse. And maybe sometimes you realize that there is no one who will be able, there is no one who will decide or accept that this person requires attention. There is no one who is going to facilitate for their treatment.
Yes.
As we said, remember, this is not a 5-day treatment.
It's a
So
long term.
actually, some of them will even go to hospital when they have drugs, medicines prescribed for them. Maybe for a month or so, they may buy for half a month
Yes.
or 1 week, and they leave it at that point. These people will continue suffering
Yeah.
because their problem has not been sorted. Others will be taken to rehabilitation centers without treatment. Yes, you cut the access. You cut the access to drugs of abuse like alcohol. You cut the access to drugs of abuse like marijuana. You cut the access of drugs of abuse like cocaine or heroin, which has been also used by the young generation. But now, yes, you've cut the access, but their problem is not managed. Their illness is not managed.
Yes.
The underlying problem is not managed. When they get out of that rehabilitation, regardless of whether they are going to stay there for 3 months or 6 months, they will come back. Some will go back to the drugs of abuse the same day they come from the rehabilitation center. Others will go back to the drugs of abuse after a week or even a month. So it is really a challenge.
Yes.
Drug abuse has really been a challenge to mental health of a great population.
Yes.
Because you realize also when the father now has this problem with drug addiction or psychological problem masked by drug abuse or otherwise, their family may break.
Yeah.
Their children may not have that parental love or provision. There will be school dropouts.
Yes.
Children will adopt the behavior of the father.
Of the father. That's my biggest
So
problem.
alcohol and other drugs of abuse
Yes.
have really been a challenge. Yes.
When it comes to mental illness, is there anything like a curse? And also, is there anything like a family lineage? Kwa wanakuanga na wazimu hivyo, so it's okay, we don't hatufai kumpeleka hospitali, kwa wanakuanga na wazimu. Is there anything like that?
It's a good question. Yeah, that's true. From the history,
Yes.
we know that there is something like curse which used to be there, and people also believe it is there until now. But the question is, and another problem actually, because now curse. What you ask yourself, what part of the body is it affecting?
Yes.
It is the brain. Possession, what part of the brain is, or what part of the body is it affecting? Brain. Mental illness, what part of the body is it affecting? Brain. So, should we accept that every psychological problem or a problem presenting, changing the behavior, the affect, the mood, or our behavior, or our conduct, that we accept that it is all a curse?
No, we can't.
No.
Yes.
We should to evaluate it. When you present yourself or the relatives bring that particular person in a healthy facility, we are able to evaluate and see from our view, from our opinion, is this a problem that is adding up to a known psychological problem that can be treated? So people should not set their mind that every problem that is affecting the way people feel, think, or behave, that it is a curse. Yes. Yeah, because as I said, it is the brain that is sick.
Yes.
and the functions of the brain are what will be affected. The functions of your brain are many: cognition, attention, concentration, sleep, mood, behavior, among many other. There are some even psychological problems or mental illnesses that affect the way you walk. You've heard of them?
What? You change the walking style?
Yeah, there are many.
The one I know is the one you go talking on the unasimama unaongelesha kichaka unaendelea.
Yeah. And sometimes when they are talking, they are responding to certain voices.
Yes.
They are hallucinating.
Yes.
They are seeing people, and sometimes they are seeing real people, but in a different angle. That this person has wrong intentions. They want to harm me, or they want to do something that will affect me. Maybe even the way they are dressed is because of me. Everything is about them. And that is really what causes them to behave in a certain manner. Yes.
I really hope you've gotten something. Like I mentioned earlier, Daktari can answer your questions, so you can always share your stories, and always remember it is very, very important to know that one of the major points I have taken home is that brain is like any other organ. So yes, we better take care of ourselves. Anytime you feel overwhelmed, anytime you feel like you are getting drug abuse, which Daktari has really insisted on, always seek medical attention before it takes over you and before it becomes, a challenge to your health. So for now, thank you so much, guys, for finding time and watching our video. We will see you in our next video. If you've not subscribed, please do, and you can also share this information, this very important information, with your friends, and it will really go a long way. Asanteni and goodbye. We'll see you in our next video.